which men share new skills, make new friends and connect with their communities. The company of other like-minded men, camaraderie and banter, and a good sense of humour, as you can see from the photographs, are placed at the heart of every men's shed. Sheds are open to men of all ages, from 18 years of age upwards, but they are predominantly attended by middle-aged men. We know that men's sheds play a pivotal role in reducing isolation and possess inherently health-promoting qualities. And I suppose with this in mind, in order to provide more formal opportunities for health programmes and initiatives, the IMSA developed a dedicated men's health and wellbeing initiative, which we call Sheds for Life. So the aim of the study was to establish a set of principles to guide the ongoing development and delivery of a pilot phase of Sheds for Life. Qualitative methodologies were used with Sheds for Life coordinators, service providers and men's sheds members to explore their visions, expectations and experiences of this pilot phase of Sheds for Life. The principles of grounded theory were used for data collection and analysis. So 3 key themes emerged from this study that can guide us on how we reach and we effectively engage middle-aged men in the shed setting through Sheds for Life. The first theme related to the understanding of the shed. This was seen as a key starting point for the delivery of any activities under Sheds for Life. Understanding the value in the connection and the camaraderie between the men, and the value of giving men a place to interact outside the usual settings such as the pub or the bookies. The shed setting also provides a chance to have a chat under no prerequisites. Adopting a shed-sensitive approach that incorporates having banter, keeping things informal, creating open lines of communication, using simple language and linking initiatives back to the community is key. The research also captured effective strategies service providers used to engage men in the shed setting, which included establishing credibility with the sheds by being introduced by the Irish Men's Shed Association, having real-world experience and an informal way of delivering it to the men, co-creating the programmes, consulting with men's sheds members and hence embracing the shed way, as well as establishing familiarity and rapport with the men. The research also indicated that men are willing to engage with programmes mirroring the informal shed setting. The research also looked at the mediating factors of how men in the sheds do health. Men spoke of how the shed provided a safe space to talk and to share common experiences about health issues, checkups and procedures. This helped the topic of health to become a more normal conversation among the men and what they refer to as, quote, taking the mystery out of it. Men displayed an openness and an eagerness to engage with health initiatives in the shed environment. The physical act of bringing health initiatives to the shed emerged as a crucial component for facilitating men to take action on their health. Interacting with health within the informal environment of the shed was seen as a less threatening than traditional health settings and was perceived by many as taking the hassle out of it. And as you can see from the quote, when you scratch the surface, there's more than just banter in a men's shed. So the key findings and learnings from the study reveal that the focus of Sheds for Life needs to strike a balance between bringing health to the sheds without corrupting the essence of the sheds. Sheds for Life should create and embed a bottom-up, grassroots and sustainable model aligned to the ethos of the sheds. The men's shed is effectively a home from home for many of its members, and in a sense they're inviting us into their home to deliver health promoting activities and advice. That kind of direct access is incredibly rare, particularly in the demographic of hard to reach middle-aged men, but it also brings with it a responsibility to respect that environment. We never forget that we're engaging with men on their ground and their own terms, and that's why we feel Sheds for Life works as well as it does. This research has allowed us to develop a clear mission statement and framework to guide all future health promoting activities under Sheds for Life that strikes a balance and accord with how 10,000 men's sheds members island-wide wish to engage with the topic of health, which embraces the shed way and respects the shed way. So thank you very much for your attention this afternoon, and congratulations to all involved in this seminar.